Hello to all. Welcome to this important discussion hosted by the National Academy of Social Insurance, Caring Across Generations, and United Domestic Workers, UDW AFSCME Local 3930, Strengthening California's Care Infrastructure, Poverty, Inequality, and Universal Long-Term Care. My name is Kimberly Alvarenga, and I am the director of the California Domestic Workers Coalition. I am honored and blessed to serve as moderator today for this important and timely conversation today. The COVID-19 pandemic has highlighted the inadequacy and inequality in our country's care infrastructure and the burdens facing individuals, families, and our communities. The reality is that the rates of poverty among seniors, people with disabilities, and caregivers has been increasing long before the COVID-19 pandemic. Today's conversation comes at a critical time because we're at a juncture where a lot of work has been done by many to advance a care infrastructure that prioritizes the true dignity and the value of care. The work of the Master Plan for Aging Stakeholder Advisory Committee has concluded, and the Governor's Cabinet Work Group now needs to write the Master Plan for Aging, which is expected to come out in December. In addition, the actuarial analysis that was commissioned by the administration and legislature last year was just released. This is a feasibility study around the creation of a new long-term services and support benefit. You can see why we're really excited about having this conversation today. We encourage you all to participate in today's conversation using the tools on your screen. There are two ways to participate. You can type comments in the chat box or use the Q&A box for specific questions for the speakers or for other participants to consider. Both boxes are available on the menu at the bottom of your screen. To kick off the webinar, it is my pleasure to introduce California State Senate President Pro Tem Toni Atkins to say a few words. Pro Tem Atkins is the first woman and LGBT person to be elected to lead the California Senate. She has been a long-standing champion for seniors, people with disabilities, and caregivers. And she has helped to secure the funding for the actuarial analysis I just talked about. She has also been instrumental in protecting state-funded LTSS programs like IHSS, MSSP, and CBAS from terrible budget cuts in the June state budget. These cuts would have devastated hundreds and thousands of low-income seniors and people with disabilities. We want to express our heartfelt gratitude to Pro Tem Atkins for all of your work and your leadership. Madame Pro Tem.
Well, Kim, thank you. Thank you so much. It's great to be with you today, making sure I'm unmuted and my video is on. I'll start, Kim, by just saying, let me just say to you, reading your story was actually re-inspiring to me. It reminds me of where I come from as well, different, but in some ways similar stories. And it re-inspires me as to how important the public work that we do really is for so many millions of lives. So I want to acknowledge you and say thank you. And for your comments about the funding and the budget, I just wanted to say Senator and Dr. Richard Payne is on. He'll be part of the discussion later. And when it comes to those critical funds, he is chair of the Health Committee, and he's also chair of Budget Sub 3, which looks at that funding. So I have an incredible partner, and I'm so pleased to see that you included him in the discussion today. I'm thrilled that I get to join you. I apologize I'm not able to take part in the whole webinar, but I really didn't want to pass up the opportunity to say a few words to all of you who are doing such important work that was incredibly demanding and needful even before COVID-19 and the pandemic, and work that has, of course, been greatly impacted by COVID-19. This crisis has highlighted the need to rethink how we support our aging populations. With an eye towards better serving Californians, I chose as the chair and the members of the Senate Human Services Committee, senators with strong experience in sectors that affect seniors. Now, this is a committee that typically is not considered to be too sexy, too exciting, but I really felt like we needed to make a commitment here. And so that included putting a committee together that included the chairs of health, as I said, Dr. Pan, housing, transportation, as well as the senator who's been most engaged in addressing the issues, Hannah Beth Jackson. So I put senior people onto that committee because of the importance of this work. And again, you'll hear from Dr. Pan a little bit later. He is also part of our emergency pandemic working group, working directly with the governor's office because of the many hats that he wears. So tasking this group with working together and with the governor's office, I believe it gives us the best opportunity to achieve the comprehensive solutions that you want, that we need, that we're talking about today. So I want to say here, I was pleased to see when the governor was sworn in that he showed some leadership and wanted to talk about aging, first in leading on a master plan for aging, which has to be a vital blueprint for our state and local governments. And so now, under the steady guidance of Director McCoy Wade, California is working on ways to mitigate many of the challenges facing our seniors. And let me just add, I'm 58 years old. So we can talk about seniors as them and that other group, but many of us are fast becoming a part of our aging senior population. In last year's budget, we were able to add $135 million to aging programs, including senior nutrition programs, aging and disability resource connections, caregiver resource centers, long-term care ombudsman, and others. This year, after a decade of careful budgeting and building reserves, we were able to hold off cuts to many of those vital programs, which you always face. But we all know there's a lot more to do. So, and also, you know, one aspect of the support system that's challenged us for many years is how to provide safety net services for seniors who are struggling with their expenses but earn too much to qualify for safety net services. So I'm looking forward to learning more about the long-term services and supports effort to reach these seniors so they don't have to spend down their retirement in order to get the help that they need. Our mission should be to lift people out of poverty, not force them into it so that they're only able to get the services they need when they've depleted everything else and are older and in more need of those services. So this issue has been reinforced recently in my own community in San Diego, when deeper demographics were released based on our annual homeless count, showing 27% of people on the street and 24% in shelters were age 55 years or older. So the people who raised our families, built our communities, made our state the 5th largest economy in the world deserve a heck of a lot better. And they're fortunate to have you having their backs. So I don't know what the virtual equivalent of my door is always open is, but the sentiment really is true. My staff and I, my colleagues and I, we respect and appreciate all that you do, and we'll be working with you to make things better for both the people you serve and the people who serve them. So Kim, thank you for giving me a few minutes to open up today.
Thank you so much, Pro Tem Atkins. Thank you so much. Before our guided discussion with panelists, we will hear a few words from Keely Stevenson. Keely is a family caregiver from the Bay Area who is active with Family Caregivers Alliance. Keely?
Hi, good morning. Thank you for inviting me to speak with you today. I woke up this morning feeling hopeful. I hope you all did too. hopeful because I get to be with each of you as you address issues facing my family and so many families across the state. I woke up feeling hopeful, thinking about Ruth Bader Ginsburg and how much of America's way of being has transformed since her 1968 case that entitled both men and women to share and the same caregiving and Social Security rights. And so hopeful because she certainly showed that we're capable of really powerful things once we're moved to care deeply enough to give our attention, our time, and ourselves to it. So I was excited to be able to share some of my caregiving journey this morning. I live in San Francisco where I have a family, run a small business. I'm very close with my parents. And they still live in the low-income neighborhood of Sacramento, where I grew up, and where they made huge contributions as a public school teacher and a police officer before they retired. And a few years ago, my dad was diagnosed with lung cancer and my mom with COPD in the same year. And these diseases are likely caused by their smoking habit, even though they quit smoking 30 years ago. Not too long after came a heart attack, hip replacements, neuropathy that limited mobility, incontinence, diminishing vision, and then ambulance rides after falls, sometimes due to dehydration linked to UTIs. And each time something major happens, I drop everything in San Francisco and race back to Sacramento, often faced with responsibilities for really complex things that I had no training in, like administering IV medication. And I remember calling my sister and we're trying to, sort of figure out how to get the bubbles out. Don't kill dad. And other things like installing grab bars in the bathroom and setting up oxygen lines so that they don't get tangled in a walker. I find myself also there on the phone trying to clarify the cost of a certain medication or device and clarify the doctor's last instructions. And then all the while cooking dinner and doing laundry, and two things I loathe, and still trying to make space for that joy and that connection with these two people that I just love so, so much. And COVID's made this reality harsher for caregivers like me. It's brought to light the political, social, and economic realities that underlie and exacerbate this state of suffering. This summer, I lived with my parents full-time for 2 months to provide care. A few weeks ago, amid the plumes of the wildfire ash and 108-degree weather, I sat in a parking lot outside the emergency room where my mom, and I had just brought my mom, and in awe, looking at the ballooning tents outside for COVID patients, and looked around at the parking lot, seeing so many people like me. People likely missing work and biting their nails, awaiting news of their loved ones inside. And there's simply no roadmap. Regardless of having been a CEO and having advanced degrees from fancy schools, I'm no better equipped to deal with these type of situations. When it comes to caregiving, we're all in the same boat, and frankly, that boat is sinking. And it's sinking even faster if you're a person of color or from other disadvantaged backgrounds, or low, moderate income in America. And like many people, I once thought Medicare would cover what my parents would need as they got older. I never thought about how difficult it would be to find caregivers. I mean, we've really struggled, and it's so costly. I mean, professional caregivers being over $20 an hour, and we just haven't been able to afford that. So I hope never to have to risk my parents' financial security or my own, as so many other people do, having to sell the house to pay for care in the future. And thus far, we've been able to make it work by getting all hands on deck. And I mean all hands, a patchwork of neighbors and distant relatives, and, sort of all filling gaps and kind of caring lightly is what we call it, to pitch in where they can. And faced with so little formal care infrastructure and support at home, we have relied heavily on them and their resources. And we've also been able to use creative technology tools to coordinate this loose network. And ironically, circling up around the care of my parents has brought about new friendships and new insights for my own health and well-being, and even inspired me to start an online caregiving platform that helps to mine for best practices and protocols for others that are in this situation just like me. But honestly, I'm scared. I'm scared of the risk of financial hardship for my family. I'm worried about someday having to sell what my parents worked all their lives to build and be able to afford care for them. And they deserve so much. And I'm worried about having to give up my own career to care for them full time, which would break their hearts. And because they know it would really just land me in the same circumstances when I'm their age. But I remain hopeful because I know there's so many latent and underutilized capacities to care. It's in our human nature. So our policies and infrastructure really should reflect that and mobilize that. And after all, I mean, love is at the root of this. Love is at the root of care. And so there's nothing more powerful than that. So I know that we can make aging awesome. I'm dedicating my life to it. And as a young person, in community college, I got to take a class with my mom. My sister, my mom, and I all went to community college together and took a class in death and dying, and it led us to do hospice volunteer work for many years. And so in the homes of so many people struggling to face the reality and support loved ones with terminal illnesses, I know that it is possible for unlocking this potential in so much love, even if things haven't changed that much in the past several decades. So John Gardner once said that history never looks like history when you're living through it. It always looks confusing and messy, and it always feels uncomfortable. So thank you for the opportunity to share my messy story with you as you make history and chart a new era for California. Thank you.
Thank you, Keely. Thank you so much for your words. Thank you for giving voice to what so many of us are experiencing and for also giving us hope and love. Now, it's my pleasure to introduce our distinguished panel. We have with us today, Kim McCoy Wade is the director of the California Department of Aging. On behalf of the Secretary of Health and Human Services Agency, she is convening the State Master Plan for Aging process. Welcome Dr. Richard Pan, a pediatrician and state senator representing the Sacramento area. As chair of the State Budget Subcommittee on Health and Human Services, he has long been a champion for seniors and people with disabilities. In 2019, Dr. Pan helped secure funding for the LTSS actuarial analysis that was noted before. He has time and again voted against budget cuts to state-funded LTSS programs. Thank you, Dr. Pan, for your leadership. Welcome Fernando Torres-Gil is the director of the Center for Policy Research on Aging and the professor of social welfare and public policy at UCLA. Dr. Torres-Gil is a member of the Governor's Master Plan for Aging Stakeholder Advisory Committee. Welcome Christina Mills, who is the executive director of the California Foundation for Independent Living Centers. Ms. Mills is a member of the Governor's Master Plan for Aging Stakeholder Advisory Committee, as well as a member of the California Aging and Disability Alliance. Welcome, bienvenidos to all of our distinguished panelists. Now, let's get started with the conversation. This important question is for Christina Mills. Are you there? I see you, Christina. The question for you, Christina, and others are welcome also to to participate and respond. Christina, how does the current LTSS coverage system in California exacerbate poverty, economic insecurity for older individuals, and people with disabilities?
Yeah, thank you, Kim, and thank you for inviting the California Foundation for Independent Living Centers to be a part of today's discussion. For those of you who don't know, we're a statewide disability rights organization and have been very honored to be a part of the master plan process, as well as a lot of different discussions on long-term services and supports. And it's always interesting to be presenting via Zoom rather than in person, because what you don't know is what you can't see, right? And so I'm a person with a disability. I was born with a disability, and LTSS is something that's personally and professionally very near and dear to my heart because of the cycle of poverty that so many people with disabilities and those who are aging often fall into as a result of being honestly on the cliff of an accident each day of our life. So whether you're like me and are born with a disability, or have nothing and you're completely healthy and been doing great things, and one day you just never know what's going to happen. And the way our system is set up is unfortunately creates a cycle of poverty, whether you're born with a disability or are aging and become disabled, in having to access state and government services to be able to continue to live your life. And so just want to start by sharing a little story about myself. While I was born with a disability, I was also born to a teen parent, a single mother, and born on a military base. And I wasn't diagnosed until about 14 months old. My disability is osteogenesis imperfecta. I break bones easily. And when I was finally diagnosed, I went onto the Medicaid system and got the healthcare services that I needed, thank goodness. But as I continued to age from childhood to youth to adulthood, it became very obvious to me that if I was going to be able to be successful and go to work after college, that I was going to have to take a significant risk in letting go of my government benefits in order to find an employer that could offer me the healthcare benefits and the long-term services and supports that the government was providing for me. I'd have to let all of that go in order to seek employment and get out of poverty. And that's so often what people with disabilities are faced with and are challenged by not wanting to go to seek employment, because it is the cycle of losing Medicaid, which is always the #1 priority for so many of us who frankly require and need care services, personal assistant services, as well as durable medical equipment. All of the things that the government fortunately helps cover for us, we are forced to let that go in order to be able to seek employment and get other types of LTSS. And when we do that, for example, in my own situation, we also let go of maybe not being able to afford in our jobs to pay for those things out of pocket. So needless to say, it's a balancing act, and it's sort of like robbing Peter to pay Paul in terms of, do I want to pay for my wheelchair repaired this week, or do I want to pay for my domestic worker who comes in and assists me once a month in our house? I mean, it's always a balancing act, and you would never expect that from somebody who is an executive director of a statewide organization and still is living paycheck to paycheck, because we don't have an LTSS system set up that is able to provide the level of needs and services so that I can be successful and my peers with disabilities who want to go to work can be successful outside of specific government guidelines that we currently have in place. And just to also add that, you know, I have a grandmother that I'm a care provider for currently. I coordinate all of her care in Marin County. But in addition to that, my daughter was born with significant disabilities. And While we were able to get her on our employment insurance and able to get her on California Children's Services, Medicaid services, it wasn't enough. And unfortunately, she passed away. But out of pocket each year, we were paying about $45,000 annually to cover her LTSS needs. And that was just her needs, not the needs of our entire family that is also made up of people with disabilities. So, you know, when we talk about the value of care, I look at care as a very in a very broad way and in the biggest way, because care isn't just personal care assistance. It's care on so many different levels when it comes to long-term services and supports. And what we really at CFILC are working towards is creating a system that allows people with disabilities and those who are aging to get out of poverty, not have to live in poverty in order to have their best life. And that's what we're really looking for, a quality of life that values people with disabilities and people who are aging that become disabled.
Thank you so much, Christina. Thank you for all of your organizing. I want to go back to, I believe we have Director McCoy Wade back with us. I would love to just go back and make sure to ask you this question about what are long-term services and supports, and why are they critical? And if you can give us a quick snapshot on the background behind the master plan for aging mandate, the stakeholder process, and where things are at right now. I do want to note that we're going to try to keep our comments a little shorter. Absolutely. Just because we're trying to stay on time. Yeah, thank you so much.
Absolutely. And I've been so happy. I have been able to hear the entire conversation, Senator Atkins, Keeley Stevenson, and it's absolutely appropriate that I go after Christina Mills because that's where we start. This is an issue that affects all of us, all ages, whether we are aging, whether we have a disability, our parents, our grandparents, our loved ones. That is why this is so important. This is the care for all of us across our lifespan. And what's really interesting about it, and part of why it's complex, but so important, is it happens in all settings. It happens when you live at home, as Christina just shared her story. It happens when you come together as you age into a group setting, whether it's senior living, assisted living, a duplex with friends. It happens in group settings too, where people might go to adult day centers. And of course, for some people, it happens in nursing homes, that more clinical health level. And for most of us, all of us are going to be needing that in some way at some time. So it's about all of us. It's about all of our homes and our communities. And the problem is we have, as I heard the governor's leadership in this area say this week, there is unfinished business in this field of adult care. Many people think we've got Medicare, we've got Social Security, adult and aging is covered. Well, we all know from our lived experience, from our lives, from our loved ones, there is unfinished business. Now, I love how Keeley started with hope. There are so many bright spots. There are so many extraordinary family caregivers in California and across the country. There are so many extraordinary high quality providers and programs and residential settings. We have got lots and lots of bright spots, but what we don't have is a seamless, smooth, coordinated system. And we knew that before COVID, and boy, do we really know it now. This has really been the ultimate stress test, and it's been too stressful. It's been too stressful for people, for families, for providers. So here's what gives me hope is that California leadership all across the board has committed that we can do better and we can finish this business. The governor's executive order, Governor Newsom, last June, this was the one issue that got named out. We're doing a comprehensive plan on aging, touching everything. From climate change to purpose, it's all there. But long-term services and supports, or as I say, adult care, was called out for a standing subcommittee, and we're so fortunate to have members of that. We also have the legislature so committed. We couldn't be in better hands with Dr. Pan, Senator Atkins, and so many other leaders in California who are committed and who've been paving the way. Our Department of Healthcare Services just finishing this actuarial study on what would it look like to follow Washington's example. So there's just so many bright spots. We have so much hope, and I'm really looking forward to continuing this conversation, hearing more about how we pull it all together to really finish the business that we all need and deserve to truly be a California for all. Thanks.
Thank you so much, Director. Thank you for your leadership. We're gonna get deeper on the importance of LTSS. And my next question is to Dr. Torres-Gil to start us off, and others on the panel can also join. The question to Dr. Gil is, the Governor's Master Plan on Aging Stakeholder Advisory Committee, on which you participated, recommended advancing a statewide public LTSS benefit. Can you share what is a statewide social insurance-based public LTSS benefit? And how could such a program help people receive and pay for long-term care services in California?
Thank you again. I appreciate being here, and my appreciation to the sponsors of this very important event, and my appreciation to the entire panel. And thank you in particular to Keely and Christina for sharing your stories. And I will address this question in a moment, but I too am both a recipient and a beneficiary of the kind of programs that California has provided in terms of supporting older adults and persons with disability. But as our state director mentioned, we still have a long ways to go. I'm a polio survivor, and I benefited from the California Department of Rehabilitation. I benefited from California's generous support, being part of a family, a single mom with 9 children to support in public housing. I benefited from Shriners Hospital. So I contracted polio, and if I can say it this way, at a good time when there was generosity and a social safety net in California. And I'm now aging with the disability, but I also benefited in another way that's changing dramatically, which reinforces the need to have a public insurance system for LTSS. I came from a very strong Mexican traditional family, 9 siblings, 10 aunts and uncles. They were my village. But when my mother and grandmother were older and needed care, they had their village. My aunts and uncles, my 9 siblings, whatever they needed, mom was taken care of at home. My grandmother was taken care of at home. We had our own informal and robust long-term care system. Now we must ask the question, will others in the years to come have that type of support? And I think it's well recognized that we are losing many aspects of that informal, traditional support system, whether it's for African Americans, Latinos, API, indigenous communities. And more, we need to ensure that we fill that growing gap with public support. And if we look at the demographics, not only are we living longer, not only are those of us with the disability enjoying greater longevity, but more of us, by the way, will be living and growing older as single persons, either never married, divorced, widowed, and we are having fewer children. And thus that's breaking down. And as we know, the available long-term care workforce is not going to be quite as available as we had in the past. So that gets to your question. That's really crucial, Kim. What can complement what we're beginning to lose? And ultimately, we need a public system that's a model of social insurance. We do not have that in this country. Unlike most of the developed advanced nations, which have universal health and long-term care services as a right, as a social and civil right. We don't have that. Various states, however, have made efforts, including Washington State, Oregon, Pennsylvania, and we now need to look at that for California. Washington State now has the first kind of public social insurance system for long-term care that requires a payroll tax, not unlike the Class Act during the Affordable Care Act, when we attempted to institute a publicly financed model at the federal level. Its great weakness, however, is that it was not mandatory. It was a voluntary system, so actuarially, it did not pencil out. So the Class Act, which could have been a model of a public financing system that we pay into and over time we receive various types of home and community-based services. That's kind of in a deep freeze. So what can California do? And not to jump the gun with our state director, but certainly in our master plan on aging, one of our major recommendations for the state legislature and the governor's office, and we know there's tremendous support under long-term care, is in fact coming up with a system of long-term services and support financing, whether it's a payroll tax, whether it's a state public partnership, whether it's an employer tax. We need to find revenues, obviously, but we are recommending that we move forward on some type of public financing, at least in California, to give some kind of support for caregiving and for long-term care services and support. Certainly, we know we need to reform the system, make it more efficient, more integrated, and certainly we need to make this a basic right as well as healthcare rights. So in answer to your question, I think we all realize that we're going to need public financing. How and in what manner and where the revenues come from still have to be sorted out. Certainly we have a recession that we have to get through, but in time we can do it. But I'll just end this last thing. One of the other great challenges besides financing and making this a universal right is how do we get the public to recognize the stake they have in creating a social safety net that assures all of us that we can have some level of caregiving and home and community-based services, given all the demographic changes we're facing. And that's one of the toughest things we have to deal with because, let's face it, most of us are in denial until the inevitable happens. And so we need to find a way to also get to not just younger persons to realize they have a stake in moving forward on this objective, but with the growing proportion of California's population from ethnic, racial, and immigrant groups, they too have an incredible stake in creating such a system that complements what are their traditional expectations of caring for one another. So we have a big challenge. I'm hoping that us aging baby boomers will put our votes and support and influence to working with the state legislature and the governor's office, and certainly for younger generations, we're doing this for them as well. Thank you.
Thank you so much, Dr. Torres-Gil, for helping us envision a future where there's dignity in care. So my next question is fit for Senator Pan. Senator Pan, as a policymaker well-versed in the LTSS crisis, what are your thoughts on the Stakeholder Committee recommendations for a new social insurance program in California? Where would you say that the legislature is on this issue right now?
First of all, thank you so very much for having me on this panel. And I have to begin by recognizing the leadership of Senate Pro Tem Toni Atkins, who gave the initial remarks when she became Pro Tem and met with each of us senators about our different leadership roles. She pointed out that the leadership on aging was one of her top priorities. I was very proud to be able to work with her on that and to make that same commitment as well as her chair of both health and the budget subcommittee on health and human services. As we are looking at the master plan on aging, this is an issue that has already come up before me as the budget subcommittee chair, even before Governor Newsom came into office. So when I first became budget subcommittee chair and I was looking at how we were spending our health and human services dollars, I recognized that we were underinvesting in aging. And in fact, I actually even posed the question during a hearing to the Department of Aging and Department of Finance as well, are we planning for our future, looking at our demographics? And I actually got the answer, well, no, we're taking it year by year. And I said, well, that's pretty scary because I don't think this is a year by year thing. We know that our population's aging, there are more demands, we have people with disabilities, and we need to be sure we're planning for that future. And in fact, I held a hearing specifically on this issue. And out of that hearing came out the fact that if we just maintain benefits at the same level they are now, so we're not talking about increasing benefits, just keeping benefits the same they are now based on demographic changes, we would need to commit to increasing the funding we're giving to aging and disabilities by an increase of 5% per year, which is larger than the growth of our GDP in the state, or of course the country as well. So that pointed out that, okay, well, we definitely need to figure out a better plan. And I was very proud to work with the coalition on a bill I had, SB 512, that actually called on an actuarial analysis to look at creating a social insurance program. Very proud that we moved that bill forward, and then the governor announced that he was going to do a master plan of aging, and so this bill sort of got folded into that. And so I'm very excited to see that we have a report coming out. Now, I do want to thank Dr. Torres-Gil for the fact that he's pointing out that it's not just about the money, it's about the buy-in, right? So when we talk about the legislature and where are people on, it's really about building that political will. And I think it's very important to figure out how we frame this particular issue, right? So as I will point out, when I'm in my budget committee, subcommittee, I ask people, said, well, oftentimes when you have a new program, finance will come and say, it's going to cost X amount of dollars. The question we don't ask is, well, if we don't do that program, how much will it cost us? That's the real alternative. The alternative is not, oh, do we want to have a new program or not? The issue is that what's the issue that this program is solving? And if we don't have that program, how much are we paying for it as well? So that's the real net cost to think about. And so when it comes to LTSS and what we're talking about here, which is a social insurance program, and I want to point out, we're talking social insurance. We're not talking about a welfare program, which has its place. We're not talking about means testing. This is about social insurance program, recognizing that all of us and our families are going to have to confront this issue at some point in time, right? And so we need to go and talk to the public, and that of course also influences other legislators as well, is that, we're not just here saying, well, we need to raise a tax to create a new program. We also have to turn and say, look, if we don't do this, what is going on? What do we have to pay for? So this is really about, it is about dignity, it is about services, and but it's also about actually our financial future as a state, and what makes sense in the way we redirect our resources and our dollars. And I think that's a very important part of the conversation that we need to frame. And so I know that I could take much more time talking about that, but I'll end it here and look forward to the questions about this, how we frame this issue in a way that people understand that, look, this is a better choice. Okay, it's not just about, well, you're paying more taxes. This is actually a better choice for the tax dollars you may already be paying as well. And so I think that's part of the conversation. Thank you.
Thank you so much, Senator Pan, for those important words. My next question is for Director Wade. Director Wade, what are your thoughts on the recommendation for a new social insurance program? And what are the next steps for the state master plan on aging?
That's exactly right. This is exactly the time that the master plan on aging is taking a hard look at this issue. So just to remind everybody, I mentioned we started last June 2019. The governor will be releasing the master plan for aging. The plan is this December. So about 2.5 months from now, we will have the master plan. We just received from the stakeholders 743 recommendations. And as you've heard from Christina and Fernando, this is one of the top ones. So, and we just received from the Dr. Pan and DHCS's work, the actuarial study on this. So right now, the cabinet work group is beginning to meet and to consider all of those recommendations, all of that input. And to be clear, the administration has not taken a position on this yet, and it is under review. But some of the questions that we are asking are exactly as Dr. Pan so ably and wisely teed up. And they're really about looking at there's conversations happening in a couple areas. So one is this question about between settings, where are we living and where are we spending our healthcare dollar? Nursing home or assisted living or home and community-based services? How could this help maybe reduce costs on one side and quality of life and independence and choice and create on others? So it's very well said by Dr. Pan, looking at across settings. We're also looking across states, right? What's the Washington experience? What's the California experience? What can we learn? What's similar? What's different? We're also looking to the federal government, as Professor Torres-Gil lifted up. The role of Medicare is inescapable in all of this, thinking about how a state fund and a Medicare fit together is critical. And so I would urge everyone to be looking at candidates for federal office, whether Senate, House, or President, their positions on Medicare and how they tend to tackle this issue. And then lastly, I would also just say there have been some discussions about private solutions, private sector solutions. The governor's Alzheimer's task force, chaired by Maria Shriver, looked at some of those as well. And again, the trade-off with a universal, more comprehensive approach. So all of those questions, looking at different types of current spending, as Dr. Pan said, looking at federal options, looking at other state options, and looking at private solutions to try to get to where the right place to be. And then the last thing I'll just say is, listen, we all know it's tough financial times, which cuts a lot of ways, right? We both have imperative to do things, and we have to think harder and more creatively about how to find the money. But this is a 10-year plan, so we will absolutely, our desire is to set these big, bold goals. You saw it with our governor yesterday on climate change and zero-emission cars, but then also take concrete steps right now to start moving towards the future we all need to be in.
Thank you, Director McCoy-Wade. Thank you so much. We are down to our last question, but we're very excited about opening it up to questions and for everybody else. My last question is for Christina Mills and others on the panel that are welcome to also respond. And the question is, what would be the implications of a new social insurance program on poverty and economic security for older individuals and people with disabilities? And what would be the implications for direct care workers and family caregivers and networks?
Thank you, Kim. Again, this is Christina. I think Dr. Pan really did a really great job in explaining the lack of attention paid to the what if we don't cover the benefits that are needed. That is really it. And, one of the things that is significantly lacking and been lacking in the disability community and conversation throughout our state and nation is data. And I'm really interested in knowing how would a social insurance benefit impact people with disabilities that are currently between that lifestyle of sticking with Medicaid versus being able to go into a social insurance program and become employed. I want to know what that data would potentially look like, because I do think that with a social insurance program, it could benefit substantially the unemployment rate of people with disabilities who, like Dr. Torres-Gil had said, he had support from the Department of Rehabilitation in seeking his employment and going on to his career. I also had the same, and I know so many people that have that benefit and take advantage of it, are grateful for it, but don't pursue employment because they're still so worried about losing their insurance through Medicaid. And so I would love to see some research and work done to find out who are we really talking about, because while our unemployment rate for people with disabilities has pretty much been stagnant, and since the passage of the Americans with Disabilities Act over 30 years ago now, we've still seen a significantly gigantic number of people with disabilities unemployed that could very much be employed. And on that same note, people who are aging want a quality of life just as much as the next person. And how many times do we hear in conversations older people saying, I'm not ready to retire, I want to continue working? Sometimes it's because they have to continue working in order to get the insurance coverage that they need. Other times it's because it's a quality of life issue. People value what they're doing and want to continue to be a part of that effort. And employment has a lot to do with how social insurance would work overall. I also think that, you know, while we look to a social insurance plan that works and covers people with disabilities and older adults, we're looking at really prioritizing personal assistance services, caregivers, because more of us might be able to qualify for caregivers and pay better for caregivers, frankly. And I was recently, before the pandemic, visiting Spain and doing a presentation on what personal assistance services, caregiving in the in-home support services model looks like in California, in Spain. And I will never forget how embarrassing it felt to hear Spain talk about they have a whole workforce and a college course for folks to become trained caregivers and have a degree in caregiving. And because of that degree and the way they've set up their educational structure to do that as a living and a career, nobody starts that job under $35 an hour. I couldn't believe that given what we pay caregivers here in California. It was just amazing to hear what Spain has done versus the United States. And I continue to learn from a lot of other countries on great ways that they're expanding and really prioritizing quality of life issues for people of all ages. And again, it's, yes, we are here talking about people with disabilities and the aging community, but this is really about a California for all and creating that system through a social insurance model.
Thank you, Christina. Well said. Wanted to see if any last words from any of the other panelists.
Yes, Kim, and just to build on Christina's point very simply, a social insurance system of LTSS is an economic boost to California. It's an economic business for the reasons that Christina laid out. And as we try to reframe how to get the public to buy in, we need to really emphasize that this will enable the California economy, will enable employment, will bring freedom and choices to caregivers and families, knowing that they don't have to impoverish themselves. And so we can reframe it that way. It will require bringing in other partners that had not normally been part of this dialogue, whether it's Silicon Valley and technology, whether it's Hollywood and the entertainment system, whether it's corporate or businesses, small and large, all of them have a stake. And so it's about the economy, it's about freedom, it's about choices, and it's really about bringing in other partners so that we all recognize the stake that we have. And I think that might give us support to create a publicly financed social insurance system.
Thank you, Dr. Gil, so much for those words. I see I'm going to keep us on time because I know that folks have questions. So we're now going to take questions from the audience. And reminder to please submit any questions in the Q&A box for those tech-savvy folks on the Zoom. I want to thank Director McCoy Wade, Fernando, Christina, and Senator Pan. Thank you so much. I'm going to now turn it over to Bill Arnone, CEO of the National Academy of Social Insurance, for closing remarks before we start the Q&A.
Thank you very much, Kim, and thank you to all the panelists for your insights. I love the combination of policy and passion, which are the key ingredients to our getting this right. I think all eyes will be on the state of California as you lead the way. But as several of you mentioned, we're a nation and social insurance requires a national response. So you're a laboratory, but we have to look at the ultimate answer being a coherent national approach to this pressing problem. My thanks to our partner in this, Caring Across Generations, the United Domestic Workers of America, and our funder, the Ford Foundation, for their support of this event. And thanks to all of you who participated in this. I hope you found it a valuable exchange of much needed insights. You'll all be receiving an email following the webinar with a link to a brief survey. Please take a moment to complete the survey. We really rely on feedback to develop future programs. And speaking of future programs, our Academy will continue to provide opportunities to exchange ideas through virtual forums such as these, although we do miss the ability to be with you in person. We'll be having 2 similar webinars on caregiving in 2 other states, Illinois and Michigan, and we expect more in the calendar year 2021. So now that you've registered for this, you'll be on our list to get information about future caregiving focused events. We're all facing terrible uncertainty in our country in so many ways. I just hope all of you stay safe and healthy. Our hearts go out to all of you in California who've been hit with one challenge after another. And let's hope we all can look back on 2020 and say we got through it and somehow we're better for it. So thanks to all of you again, and thanks to all of you being part of this very important webinar. Bye-bye.
Thank you, Mr. Arnone, for those important closing words. I am now going to open it up for Q&A and really invite the panelists to feel free to respond to as many as possible. The first question is from Carmen Lee. What do you think about tax? What do you think about tax to make billionaires pay for LTC safety net?
Well, this is Dr. Pan. I would just say that any form of tax on anyone is always a challenge. I think that it really is about how, where we build the public will. I guess one of the things that I would caution is that we can't and I think certainly many of our billionaires, we can argue, don't pay their share, and they certainly are doing very well even when others aren't. But as we look at the financing structure, I would be cautious that especially for a program like this, we want to be sure we have a stable financing system. So for example, California's budget is very dependent on income tax. So that means we have very large swings in the amount of revenue we get from year to year. So we basically swung this past year from a $20 billion or plus surplus down to a $50-some billion deficit. And for a social insurance program, we probably want something that's a bit more stable from year to year. Obviously, this will be over a period of time. So that does even out a bit, but those are some of the things one needs to take in consideration when it comes to how it wants to finance particular programs. I'm certainly not opposed to thinking about how we get people who are better off to help better finance many of our public programs overall, though.
Thank you, Dr. Pan. I'm going to read a request to see if folks can help provide some information on the chat. And says, from Kwai Wu, could you please kindly provide some links or resources about the new social insurance program? Thank you. And with that, I'm going to take the next question from Joanne Lin that is directed to Dr. Fernando Torres-Gil. Please comment on the merits of federal catastrophic long-term care insurance, leaving front-end coverage states and localities, families, and LTSS insurance.
Thank you. I think the question was referring to, who is responsible for which part of paying for a caregiving long-term care system. Does the state provide some kind of revenue so that it pays at the front end? Or does it put the responsibility on the individual to accrue the benefit by paying in over time, which was the intent of the Class Act? Or do we use Medicare and Medicaid to provide the front end or the back end? I mean, these are intricacies of how you arrange the ultimate financing structure. I think the great challenge will be, in the best of all worlds, if California adopted a social insurance plan, which, by the way, Taiwan and South Korea are excellent examples. They've adopted a universal long-term care financing plan just in the last 5 years because they're facing all the demographic issues. So they have to face, the issue of, do we pay the front end through the public system, or do we require individuals to start paying on their own. And so there's different ways to handle it. In either event, there will always be a large portion of the population, low income, ethnic, minority, vulnerable populations that will not be able to pay the front end with their own dollars because they'll have very few dollars. So we will need at least some system that enables low-income persons to have financing, and the rest of us, like myself and Christina, who benefited from a good education, to pay forward and then expect to get coverage on the last part. For myself, I'm one of the very few that actually is willing to pay for private long-term care insurance, which will cover the front end of my costs, and then our savings. And then if we spend down completely, hopefully, Dr. Pan, by that time, 10, 15 years from now, you will take care of me with the back end. But there's different ways to do it. It's a question of ultimately ensuring that the most vulnerable have something at the beginning when they finally need it.
Thank you. Next question to the panel from Lindsay Imai Hong. I will read it. It's a good question here. Thanks for the great panel. As you've said, all Californians need long-term services and supports. However, not all Californians can contribute to a social insurance program through a payroll tax for some of the reasons that Christina Mills has shared. What are some viable options for progressive funding sources that would ensure that a new LTSS social insurance program can cover all of us, including people with disabilities of all ages and current retirees, without overburdening those of us already struggling to make ends meet? Thank you. Lindsay from the California Director of Hand in Hand, the Domestic Employers Network.
This is Christina. I appreciate the question, Lindsay, and I think that we're going to have to, while we haven't figured out what that solution or that sweet spot is, it's certainly going to be a need as we move forward. And whether it's contributing to make sure that everybody is covered in California through those that might not necessarily be able to pay into the system in the beginning, but would ultimately pay into it at some point in their life, I think we have a need to make sure that everybody has the same equitable long-term services and supports benefits when they need them. And I'm eager to see the results of the actuarial study. And I know, and I'm hopeful in California that our research and the work we've done over the years is really going to pay off, because like some of the other states, our state chose and was dedicated to bringing the disability community and the aging community together from the start as a part of our work in the California Aging and Disability Alliance to ensure that both communities are a part of whatever social insurance model ends up becoming a reality for all of us in California.
Also, I just want to make
This is Kim. Could I add?
Sure.
Please, both of you, go ahead.
Sure. I mean, another way that I think about it is, while we know that if you use Medicaid, you have a certain set of challenges in accessing long-term services and supports, and if you use Medicare, you have a certain set of challenges in accessing long-term services and supports, and those are in some ways different challenges, and there's some ways the same. My belief is that we need to address both the Medicaid challenges and the Medicare challenges, right? It's the payment systems, but ultimately we're creating a universal system. And whether it's paid for by Medicaid or by Medicare or private insurance, the payer doesn't drive the experience and the quality and the coordination of care. So we have to recognize that who pays right now does matter a lot as we diagnose the problems and map the solutions. But I hope we are holding on to that vision of a universal care system that all of us can access and as we need, whether we're recovering from a fall from a short term or managing dementia over the long term or anything in between, that we are driving toward that universal system.
I would also say that, this is Richard Pan, that we do have to figure out how we build the political will and the sort of consensus across the state that this is something that we need. So, we're all talking to the converted here, but we do need to build that consensus across the state. So if you think about it, we have a consensus that we should have a public education system, right? And even a statewide system of higher education. That's something that Californians came around to agree on, right? We have a healthcare system for at least the low income and for seniors, right? So that's Medicare and Medicaid, right? So there was a national consensus around Medicare. And we need to figure out how we develop this consensus around LTSS. And I think the work that's being done is certainly a very important step, but we need to continue to work on building that consensus. I would actually say that the people we need to really target and to buy into this are middle-class families, right? Middle-class families are the ones who basically can't afford LTSS service when they finally need it for either themselves or their parents. They're the ones spending down, after retirement, their income so they can get on Medi-Cal. Or they're the ones who are watching their inheritance basically being spent down when their parents have to, because they can't afford to pay for it when they finally need it. And I think that's going to be something that's very important to communicate, that we need to take a social insurance approach. So in the same way that we eventually finally did establish Social Security, almost 100 years ago, we need to have that conversation as we have this aging population. And I think that that's very important. I think, again, we need to engage the disability community as well about the lost opportunity for people with disabilities to contribute to our state because of the way we set things up. So we do need to work to get this general idea, and that people understand that they need to be willing to pay into this, right? And then the details obviously are very important, and we got to work those out too. But we do have to build that general political will around this particular issue in order for us to be able to organize and finance it as well.
Thank you. The next question is from Bill Pelter. The health and human services system is difficult for seniors and their families to navigate. Our system navigators to assist seniors and their families included in the Master Plan on Aging. This would also help mitigate some of the health disparities we currently experience.
This is Kim again, and I would just say, I mentioned earlier there were 743 recommendations. The very first one to come in and be approved by the SAC, the Stakeholder Advisory Committee, was that one you just lifted up. That the confusion around who do I call, how does that connect? In some communities it's very clear, but in too many communities it's not. And so that absolutely, we have the beginning of that in California with the Aging Disability Resource Connection covering about a third of the state. Although even those folks could do more to do the kind of high touch expert care coordination. And we've been seeing what's happening in Marin County with a new branding of that as One Door to try to make it as well known. Out here in California, we have First Five, which has very high recognition on the public as a place to start and call for young children. But we don't have kind of that clear, is it one door, no wrong door, ADRC. We've got to get that public support, public will, and as you just pointed, public information so that when you need help, you have it. And those two things, in my mind, go hand in hand. Being able to access the system more easily will feed on the cycle of building support for a higher quality, more accessible, more affordable, more coordinated system. So absolutely in the mix. We
have a question from Joseph Wilson. Are there any plans to address the shortage of caregivers?
Well, this is again, I don't want to speak for everyone else, but absolutely, Secretary Julie Sue, our Labor Department Secretary, has been very, very interested in this issue of how we do address the workforce issues head on, in some of the ways that Christina was sharing from Spain in terms of helping make those jobs good jobs and career jobs. But we also, I think, and Dr. Torres-Gil has been so expert on this, that we also need other solutions, supporting family caregivers who continue to be the primary provider of care. How do we do respite and Social Security and other things to help family caregivers? We have to look at technology. Are there some tasks that are made simpler or easier or possible through technology? And again, we have to look at kind of all possible innovative and creative solutions, more group living that are appealing and seem like, positive group housing that allow us to use caregivers more effectively and hopefully provide a more dignified and independent and less isolating way to live. So I think all solutions are on the table. It's really about putting it into a plan and putting it into action.
So this is Richard Pan. That's a very important question. As someone who's been part of some workforce groups as well, unfortunately, this is a fairly neglected area. So, we've had there was a workforce report about healthcare workforce. They never touched on really in any serious way on long-term service supports or CNAs and so forth. So I find that very unfortunate that even when men pointed out to them that that was a deficiency, that they did not decide to pursue that. I also think that, for someone who's entering that field, right, who's entering the field of being a caregiver, there's a lot, the complexity and uncertainty, which of course also is affects, the person being cared for, also affects, of course, the caregivers themselves, right? So, what's the path forward? Frankly, our state, our state budget, we have proposed, we kept hanging over their heads, a 7% cut, even though we didn't actually implement it. And I'm not sure what message that sends to caregivers as well. We need to commit ourselves to saying that we're serious about what you're doing. We do need to create more certainty in terms of caregiving, both for the person who's receiving it as well as the people providing it, and also again creating a LTSS social service, social insurance net. I think helps provide this more of this certainty. I think there are challenges when right now when many of the aging programs, not only are they fragmented, they are often very vulnerable to swings in the budget. And that is not something that I think encourages people to engage in caregiving as a long-term. I mean, they will because they care about people and they may be in a role where they need to do that. But it's, I think we need to give people a little more certainty in terms of this as a career path for themselves, as I think Christina Mills pointed out in Spain or in other places.
Thank you so much. Unfortunately, we only have time for one more question, as we're actually on time. And I wanted to get as many questions in. This one is from Kayla Shore. Thank you for the compelling panel. Could you speak to some specific possibilities of plans for public financing of this program?
This is Christina. I'm not sure that we're there yet. I think that our next step in the process is, now that we've done some research, and thanks to Dr. Pan for sponsoring the bill to get the actuarial study done in California, we now need to look at what would be possible and what needs to happen next to take the next step in creating a social insurance plan. So I think it's really important that we evaluate that, but also want to point out that the SCAN Foundation, pre-COVID and during COVID, has done some polling on priority issues facing Californians. And recently they held an event that I was a part of, and I thought it was pretty fascinating that pre-COVID and during COVID, LTSS, among all voters, very nonpartisan issue, still believe that long-term services and supports is a priority that California must tackle and create a system for moving forward. So even during a pandemic, while we are faced with so many priority issues at the same time, it rose to the top again. And that really says that, to me, the voters are expecting some change, and that we need to create a system that works for folks, and it's not a partisan issue. And that's really important to show the legislature and lawmakers as well.
Any last words from any of the panelists?
So this is Richard Pan. I just, first of all, I want to thank the governor for his leadership. Very much looking forward to the report from the governor's master plan on aging. I anticipate when it finally comes out, I believe you said, I think they said December, that certainly it'll be examined closely by the legislature. I wouldn't be surprised if the committees I chair might consider doing an informational hearing to go over those recommendations as well. And very much looking forward to working with the governor's office and in basically moving forward the issue of aging and particularly specifically around the idea of creating an LTSS, a long-term service support social insurance program. And I really appreciate the work that's been done on this, and looking forward to working with all the stakeholders here who've participated in this conference in doing that and building that political will we need to make this happen.
Thank you so much, Senator Pan. Well said to end our webinar. I just want to thank the sponsors, the panelists, and all of the participants for taking the time with us to be part of this conversation. We know that it's an ongoing conversation, and it's truly been an honor and a privilege for me to be part of this. So thank you. And that's my hope, and we will continue to work until that happens. So thank you so much, and we are done for today. So blessings, and wishing everybody a wonderful week. Stay safe and healthy.